Hey everyone, today we're basically becoming medical detectives. We're going to decode the incredible stories that our pets' bodies are trying to tell us, through things like x rays, CT scans, and MRIs. So let's just dive right in. Okay, so let's start with this. Look at it. This is way more than just a picture, it's a catastrophe. We're looking at a shattered spine. So you have to ask, what happened here? Just how bad is the damage? And seriously, where would a surgeon even begin to fix this? Well, this is the exact kind of medical mystery we're going to solve together. Now, to solve mysteries like that, you obviously need the right tools. Think of x-rays as our frontline detectives. They're perfect for getting that first look, right? An initial screening. But for the really complex cases, the ones that need a full 3D picture, well, that's when you call in the specialists, CT and MRI. They give us these incredible, detailed cross-sectional views that just change the game. All right, so here's our game plan for today. First, we'll talk about when x-rays just aren't enough. Then, we're going to decode some of those mysterious puppy growing pains. After that, we'll solve some really tricky skull and nasal mysteries, and then dive into imaging the fragile spine. And to finish it all off, we'll put together a handy radiologist's cheat sheet. Okay, Section 1, when x-rays aren't enough. Look, x-rays are incredibly powerful, don't get me wrong, but at the end of the day, they're kind of like looking at a shadow of a 3D object, and sometimes the most important clues are hidden right there in those shadows. So, here's the critical thing to remember. X-rays have some major blind spots. They really struggle with things like neurological diseases or trying to spot spinal cord compression. They can even miss the very first signs of a bone infection. And, as we're about to see, they often just can't capture the full, complex picture of what's going on inside the head. All right, let's open our first case file. Decoding puppy growing pains. You've probably heard that term, right? Well, it's pretty vague, and it often masks some very specific and pretty painful developmental bone diseases. So in this case, we have two main suspects. First up is something called panosteitis. This one shows up as this weird, shifting lameness in young, large breed dogs. 1 week it's the right leg, the next it's the left. Our other suspect is hypertrophic osteodystrophy. We'll just call it HOD. This one's way more dramatic. We're talking fever, swelling, serious lameness, usually in large or giant breeds. So they present differently. But the real question is, how do they look different on an x-ray? And here you go. This side-by-side just illustrates the difference perfectly. On the left, that's our panosteitis. On the right, that's HOD. And you know what? Even if you're not a radiologist, you can tell these are two totally different patterns. So let's break down what we're actually seeing. Okay, here it is. This is the aha moment. For panosteitis, the telltale sign is what's called an increased medullary opacity. Basically, it's that dense, white patch you see right inside the main shaft of the bone. Got it? Now for HOD, the key clue is totally different. It's a metaphyseal radiolucent band, which is just a fancy way of saying there's a dark line running right near the growth plate. So there you have it. Two distinct diseases, two totally distinct visual signatures. Okay, check this out, because this is a case where diet literally writes its own story on the skeleton. What you're seeing is called nutritional hyperparathyroidism, and it's often caused by something like an all-meat diet. It leads to such widespread bone loss that the pelvis, well, it actually deforms under the animal's own weight, creating this really classic and kind of unforgettable sign called the coat hanger pelvis. All right, let's move on to the skull. We're talking about one of the most complex, three-dimensional structures in the entire body. And because of that complexity, you really need to bring out the big guns, the advanced imaging. You know, this quote really says it all. The source material is crystal clear. Radiographs alone are insufficient for head imaging. And it makes sense, right? You've got all these overlapping bones, all these intricate cavities. It just creates way too many shadows for a flat 2D X-ray to sort out properly. And this is exactly why. Just look at the difference. On the left, that's your standard 2D X-ray of a skull. But on the right, that's a 3D reconstruction from a CT scan. The difference in detail is just staggering. With the CT, you can digitally peel back layers, see the full extent of any fractures. You can understand the injury in a way that a simple X-ray just makes impossible. And the data totally backs this up. It's not even a contest. When you're talking about skull fractures, CT scans are just way better. Studies have shown they find 1.6 times more injuries in dogs and a full twice as many injuries in cats compared to regular X-rays. And it's simple, right? More information means a better diagnosis, which means a better plan for the patient. Let's look at another case file here. This is something called cranial mandibular osteopathy, or CMO. It's this really painful condition where extra bone starts growing on the jaw. And the source material gives us this fantastic little diagnostic shortcut, almost like a keyword to remember for an exam. If you see a young terrier and it's got a swollen jaw, your brain should immediately be thinking CMO. Man, this is another one of those really powerful comparisons. So look at the nasal x-ray on the left. You can tell something is wrong, right? It's just cloudy. But what is it? Now look at the CT scan on the right. Whoa. We can see everything. Those delicate inner structures, the turbinates, they've been completely wiped out by a tumor. You see the difference? The CT doesn't just suggest there's a problem, it defines it with incredible precision. And that brings us to our final investigation, the fragile spine. And when you're dealing with the spine, there is absolutely zero room for error. The stakes are incredibly high, which means you have to use the best, most advanced imaging you can get. What you're looking at here is a really dangerous infection of the spine called discospondylitis. So what's the one single clue a radiologist is hunting for? It's the destruction, or lysis, of the vertebral end plate. See how the edges of those vertebrae look all fuzzy and kind of moth-eaten? That's the infection literally eating away at the bone. Okay, but what about something way more common, like a slipped disc, IVDD? This is where x-rays are just frankly unreliable. Why? Because they can't see the disc itself or the spinal cord. They're just not designed for soft tissue. So the crucial point to take away is this. When you need to see soft tissues, like the brain or the spinal cord, MRI is the undisputed king. It is the gold standard, period. And here we are, full circle, back to that shattered spine from the beginning. On the left, you've got the x-ray. Yeah, you can see there's a fracture, but the details are so murky. Now look at the CT scan on the right. It's a whole new world. We can see the exact fragments, exactly how they're displaced, and most importantly, how they might be impacting the spinal canal. This isn't just a better picture. This is the surgeon's blueprint. Okay, so after digging through all those cases, let's put it all together into a simple radiologist's cheat sheet. This will help us remember all those key patterns we've been talking about. Really, this all comes down to pattern recognition. So let's do a quick recap. You see that dense white patch inside the bone? You should be thinking panosteitis. You see that dark line near the growth plate? That's your clue for HOD. Vertebral end plates that look like they're being eaten away? That's a huge red flag for discospondylitis. And if you see those nasal turbinates are destroyed, you have to be worried about something aggressive like a tumor. And finally, maybe the most important takeaway of all, it's all about using the right tool for the right job. For anything involving complex bone, like the skull, the nose, or a bad fracture, CT is going to be your best friend. But, and this is a big but, for the delicate soft tissues of the brain or the spinal cord, like with IVD, nothing is better than an MRI. So what we've really learned today is that these images, they aren't just static pictures. They're stories, they're narratives, packed with clues and patterns just waiting to be read. So I'll leave you with this question. Now that you know how to spot some of these clues, what other incredible stories do you think are waiting to be told? Right there, just beneath the surface.